love some backwards audio. Why can't we play it forward? Because we don't have the band's permission and we're losing money because they're dinging us. Hey, it's Southside Steve, and welcome to the Yeah Come On show 148. Am I right, Brett?
You are spot on.
Boomsy.
It's as if you already knew.
148 episodes to get there.
It took me a minute, but we're here. I usually get this wrong. This is show 148. I'm your host, Southside Steve. That's my co-host, Brett Barney. And that's my co-host, and that would be one Evan Brando. And we are the Yeah Come On show, and we have a special guest. And he's not in Atlanta right now. He's on the West Coast. So he's experiencing, daylight right now. It's nighttime where we are. And he is in California, actually in Santa Monica to be exact. And this is a guy that knows me pretty well. He knows my hairline because he designed it. It is Dr. Ken Anderson, and that is of Anderson Center for Hair, located in Alpharetta and Sandy Springs. Alpharetta was closer for me. That's where I went. And we're having you on as a guest, Dr. Ken Anderson, just to talk about hair treatment, what you can do. Obviously, you come on Rock 100.5 Axel on Southside once a month. And I'm a proud endorser. Axel will get his hair done by you, then my father-in-law, and we're going to show the progress. And you are the best at what you do. Before I let you talk, I just want to say that you are a triple board certified facial plastic surgeon, if you didn't know that. And you've been doing hair treatment for over 20 years. And now that's all you do is hair transplant surgery. You practiced in Beverly Hills for 10 years. That's probably why you're out there seeing friends. Then after being at Beverly Hills, you became the chief at Emory of the hair transplant surgery. That speaks highly just to be at Emory alone. And after doing that, you're like, you know what? I think I'll do it myself. And that's when the Anderson Center for Hair was born. And you are the best at what you do. And if you didn't think so, in the UK, they put out a GQ magazine version. This is the UK Medical Consumer Group. For the past 4 years in a row, they say you are the top 25 hair transplant surgeons in the world. Top 25, and we have you right in Atlanta. And like I said, I've already had my hair done. You gave me hair in the front, put a little on top. So I will have a full head for the rest of my life. Cheers to you, Dr. Anderson, on the Yeah Come On show. How you doing, buddy?
Good, bud. Good. Well, thank you for that wonderful and detailed introduction. It's great
I can say here. More. I've got paragraphs on you. I know your love.
I've been doing hair transplant surgery a long time, and I just work hard. I really I love what I do. I have a lot of passion for it. And I've got a great team to back me up in Atlanta. And you're right, I was in, after my fellowship in facial plastic and reconstructive surgery, my first job was in Beverly Hills at a full-time hair restoration surgery practice. And I was here for about 10 years before I joined Emory in Atlanta. I have family in Atlanta, so it was a good 10 years. I lived in Marina Del Rey, just down the street here from where I'm at Santa Monica. Obviously, I'm in a hotel room here in Santa Monica. And
no, I thought that was your bedroom. I'll be honest with you. I'm like, look at you in your bedroom. And there seems to be a woman walking in and out. I don't know what's going on. None of my business.
Yeah, I'm here with my girl. But we just did. So then the viewers may not know, we just did Steve's procedure. What, about 3 weeks ago?
3 weeks ago. And I was back to work the very next day.
Yeah, and, I was surprised at that. I'm not surprised.
I do have hair, but you moved a lot of hair. I don't even know how many you do. It's not even about the follicle count, which I think is what a lot of companies do. A lot of the companies that charge less don't do as good of a job and don't have the God-given ability that you do. Now, I know you've learned, you've been taught.
Here's something that'll blow your mind. Here's something that everyone, in the industry charges by the graft, like how much hair you're going to get. We're going to charge $8 per hair graft. The reason why that's so unusual that way, because the hair grafts these days, the follicles, it's a hair by hair transplant. So the individual follicles are like 1/3 the size of a grain of rice, and when they're all packed in and the recipient area and in the area on the scalp that is receiving all the hair, you cannot. They're too close together and too numerous to count. So why does the entire specialty sell that way? The answer is, when the industry started in the 1970s, it was done using 4mm round punches. They would punch out some hair in the back of the head. They'd take a 3.5mm punch and maybe core out a little punch in the front, and then put that graft in there like a potted plant. Okay. And to the entire frontal hairline, you'd use like 15 grafts. You could count these grafts from across the room, right? Because they look like carrot stalks, or little, like, doll's hair kind of. You could easily count them. And so they would say to the patients, you need a whole head of, these grafts are $80 a piece. How many do you want? Which in and of itself, putting the patient's care in their wallet like that is unethical. But the grafts have all gotten really small, and the practitioners like myself and all the other doctors doing it, they know that the patients you can't tell the difference between 24 and 2,800 follicles after a modern procedure, yet they still continue to charge that way. So at my center, I just do basic size pricing for those who are watching. If you basically get what you need. If you need a little bit in the front, we call that a small. If you need an extended procedure, a large, or sometimes guys need extra large procedures, it's kind of a range of follicles. If we need a little bit more of the day of surgery, okay, you get a little bit more. I try to really deliver, what the patients need. I mean, I shouldn't, it's a weird industry where it kind of is put on the patient to figure out how many 2,000 follicles will cover, but I don't really believe in that. But that's why.
No, and I think it's extremely ethical as someone that's been exposed to the industry, having friends in the business and seeing those billboards, $2 a graft, and things like that. And then, it just freaks me out. And then I knew of you, and having you on and being able to have the procedure performed by you is like rock star. People don't realize that there's so much out there as far as this will grow hair. The only way to get your hair back is to do a transplant surgery where the hair grows in an area where it will grow for a lifetime, is moved to an area where it grows no longer. And then it works. And then it's doing what you've done. You've never had a transplant surgery. You've never had this performed. But what you do is you have an ointment, and then you wear a laser cap, which basically keeps the hair that you have. And that's the other part of the deal that people need to realize. It's once you've done it, it's keeping the hair that you have as well.
Yeah. Well, it's interesting to note that that hair loss, it's not a disease, right? It's not a disorder of any sort. It's a natural part of the human experience that not everyone has to endure, but we don't generally as a society prefer it. And so it's kind of like, you can think about it like a dental decay. Hair loss and dental decay share a lot of things. They're both natural phenomenon with obviously no cure. You can't cure what's not a disorder. They're both phenomenon are progressive in nature, in that they just get worse and worse and worse over time. They're with you for life, right? Hair loss never really stops ever. And number 5, they both require very specific daily treatments to try to effectively control. A hair transplant procedure in that dental decay paradigm is like filling a cavity. And so, if you're considering getting a transplant, replacing some lost hair, you don't want to forget about prevention, because that would be like having a cavity filled but not brushing your teeth, and you're going to get more cavities. And so the topical solution that we have, it has 5 different prescription medications in there. I designed it myself. It's made individually for my patients, one at a time. It's kind of like the Hims and the Keeps stuff you see on Facebook, but it's made with American drugs. Those are sourced from the Hims and the Keeps. Those are sourced from out of the country, Pakistan, India, is my understanding. That's why they're available on mass scales like that. But I have them compounded right in Sandy Springs, right in the same location as my Sandy Springs office. We've got laser therapy. We've got PRPs, a couple of different highly effective things to try to do to control hair loss. It complements the surgery well, so that your results can last a long time. And Brett and Evan, if you guys have any questions.
Oh, I was actually about to jump in right there because
Sure.
I felt like you were talking directly to Evan and myself. I know that I'm 33 and Evan, what, you just turned 29.
29, yeah.
Yeah, and look at your coif and look at my my forehead quickly is becoming a 7 head, which by 35 might be an 8 or a 9 head. So I'm assuming Evan's not going to need some help like this, but I've already been looking into it.
Well, that's good. Well, yeah, it hair loss affects. I've got 15-year-old boys in my practice who the hair loss is starting that early. Man, what a difficult situation that
Oh
must
my
be.
God, yeah.
That's the worst, man. I mean, most people get it in their early to mid 20s. You start to see it if you're going to lose it. And then there's the people like my father that started losing hair in his 50s. And you're like,
Yep.
well, that was a pretty good run. But yeah, the people that it affects, when I see somebody that's in their 20s and is losing hair, I just hate it for them.
Steve, that would be me. That would be me right here.
Well, I will tell you, Brett, we haven't talked much about it, but the best time to address hair loss, and it does not, surgery should be a last resort. Okay. Steve's had hair loss for a while. He's on all the prevention, but the hair is not coming back. Sometimes I will say, if you're under the age of 35, sometimes that topical along with the laser therapy, it might take a year, but some or all of the hair may come back. And so treating the hair loss, okay, with the preventative stuff is a good first step. The surgery doesn't treat hair loss. It treats the results of hair loss. Okay. Your hairline is receded. We can see some scalp. We can call that scalp show. That's the result of hair loss. That's what a transplant would treat. The further progression of hair loss itself needs to be treated independently. And that's why when patients come in, they're worried that we're going to kind of foist surgery on them, right? Let's sign you up. No, that's, especially for younger guys like you, Brett, I would say, well, what are you doing to prevent hair loss? And you might say nothing. I'd say, well, let's try some things.
That's spot on. Nothing.
Yeah, well, then I would try a few things and spend a year seeing if we can get some of that hair to grow back naturally. Steve, you mentioned that the only way to get it back is with surgery. That is true much of the time, especially in guys a little older. If it's gone, if the hair is gone and it's just like, hairy like an egg and it's bald, there's no hair left, you're not going to be able to revive that. But if you've got areas on your scalp that are kind of thinning, it's kind of getting a little bit see-through, you get maybe getting a light bit of a spot in the back. Those areas sometimes with various treatments, we can thicken up and have those follicles that are growing thinner hair reverse their direction and kind of grow some thicker hair. So there's a lot to learn and a lot to, but it's kind of exciting. There's never really been a better time to have hair loss because there's all these new treatments out. But if you come to my, Brett, you should make an appointment and come, get a consultation. It's totally low key. It's about as involved as this. We'll sit down. We'll have a Gatorade or a coffee or whatever, and we'll just talk about it. Really. I try to educate my patients.
I knew that I was in trouble when my brother, who's a couple of years older than me, he started doing some treatments in his early 30s. Now, granted, he has young kids like Southside does. And I was thinking, okay, that's just the kids. I don't have kids yet. Fingers crossed. Who knows? But I'm sitting there going, okay, he's doing all of this stuff. I'm in my late 20s. I don't need this. I don't need this. Then I start working with this guy about a year ago, and he sits next to me. He's like Evan. He's from Chicago. He's Italian. He's got that coif. He's 61 years old. And I go get a haircut, and he looks at me. He goes, man, that haircut's nice. A little thin up top, though. And I'm going,
yeah, that crushes you.
Woo!
What a dick.
Crushes you. No, that's horrible. I had a girl point out to me the very first that I had a little spot on top of my head. That was like 1990, 91. And I'm like, just into my 30s. And I'm like, what? I freak out. I got a mirror. I'm looking and everything. But you always remember the first person that ever says anything to you, because hair loss is difficult. Some people don't care. I've got a middle brother, went completely bald, but when he had a full head of hair, if you bet him $100, or shave your head, he'd shave his head. He didn't care. There's people out there that just don't, and I dig that. But if it matters to you, or you got a weird shaped head, or it helps you with confidence, or you're in the dating world, you love your hair and you want it back, why not do something? And, like Dr. Anderson said, the fact that there's things that you can do, and I hope everyone just caught that it's laid back, it's low key, it's a free consultation. Dr. Anderson meets with you because everybody is different, and he realizes that.
Yeah.
And you're not going to have surgery pushed on you. But if that's the only way it's going to work, then it's talked about. Yeah, there's a price tag, but it's not as expensive as a lot of other people charge, and you can pay for it over time. You can put it on your credit card. Why not make a $200, $300 payment for a couple of years or whatever to have your hair back? I mean, who wouldn't do that? Look at how you waste money going out to dinner or bar tabs or things right now. It just depends on where you are in your life and what you want. But I can tell you this, and I swear hand to God, Dr. Ken Anderson is the absolute best at what he does. They put him in the top 25 in the world. I put him number 1. And he's right in it. He's in Atlanta, man. He's here, and he's at the Avalon in Alpharetta, and his office is rock star. And there's like 5 sweet girls that when I went in, and they're working, and everybody's so knowledgeable, so kind. And it's really not the high pressure situation that a lot of people think it might be.
No, I didn't want that for my practice. Hair loss hurts. Hair loss really hurts people. And
Amen.
It affects them in a negative way. And there are practices out there that are gonna, do the hard. No, hair loss, as I just mentioned, it never really stopped. And so the kind of doctor-patient relationships that I start every day at my practice with the new patient appointments, they're long-term relationships. They're lengthy, lifelong if you think about it. And so I'm still talking with some of my patients that I initially met back in 2005 and 2003. I mean, it works like that. So it makes so much more of a powerful difference to someone's life than, say, trimming their eyelids. I'm a facial plastic surgeon. I used to do all the full complement of facial plastic and reconstructive surgery, facelifts, nose jobs, eyelid surgery, this sort of thing. But when I discovered hair restoration surgery and how powerful it can be, it really changed my view on what cosmetic surgery can do. And if you look at the studies that have been done in the psychology and psychiatric literature, some of my patients, try to, right in front of me, they'll try to talk themselves out of doing something about their hair loss. They'll say, oh, this is just vanity. It's not vanity. We as human beings, and there are many, many studies that confirm this, when you see someone with hair loss versus someone who does not, with a full head of hair, the person with more hair has been proven, before you even meet this person, just based on looking at them, you think that they are more successful. Mm-hmm. You'll think that they're younger, and you'll think that they're more attractive. Women, that's guys with more hair do better on dating sites. That's another fact. And we're kind of, our brains are hardwired to have these opinions. And so I tell my patients, I said, no, you're gonna notice when you get your new hair that people you don't know, people in the grocery store, the cashier, they're gonna treat you differently. And that's been confirmed over the years, the 20 or so years I've been doing this. And so it's if you think about it, the hairline itself, the hairline is a cosmetic subunit of the face itself, like the eyes and nose and mouth. And so when you lose the frame to the face from the top, you look different. You've seen, like Howie Mandel and Bruce Willis look different without their hair. And so it's powerful, and it's a real privilege to be able to sort of work with patients to help them with that. But
no, I'll tell you guys, Evan, you're in a relationship. I mean, will you get married to this girl? I don't know. You've got hair, so there's possibilities. People, you look successful. Once they get to know you, they realize you're not.
Yeah.
But it doesn't matter.
Oh yeah. I make a great first impression because of this guy.
Yeah, but you got
two different beds behind Evan and Dr. Anderson.
Yeah. But I will tell you,
it's a guest bed. It's a trundle bed.
It's okay. It's where you sleep. You're a lonely man. It's okay. It's okay. But no, I will tell you that my 419, I would probably be 49 if I didn't have hair. My opinion. I've got a great personality, but let me tell you, hair helps. It's always been a comment.
Oh,
And I agree with you, but it makes me feel confident. And I can tell you right now, and Dr. Anderson will agree, and I think everyone listening will, confidence is what's attractive. If you can be confident, that is the most attractive thing in the world. I think that's what a lot of women are attracted to. And I think that if anything shakes that or you lose that, then I think you're in a tough spot.
Let me ask you this, Dr. Anderson. Is there something, say there's people out there who haven't begun to lose their hair or only a little bit, is there something that we should be doing? Like, should we be taking a lot of B12 or any sort of thing like that?
Well, again, hair loss is not a disease. So taking vitamins and so forth is not really going to prevent hair loss. Hair loss is you simply inherit a genetic sensitivity to the hormones that cause hair loss that manifests at some time during your life. It could be as early as 15 years. I'm talking specifically about male pattern hair loss. There's many different types of hair loss, but the one that the male and frankly female pattern hair loss. Female pattern hair loss tends to manifest and start right around the age of 50. So that has that's kind of a timing thing. I rarely see women in their 20s and 30s. Or not rarely, unusually, it's unusual to see someone in there. But with guys, it can start at any time. And so really you don't have to if you don't have hair loss, you don't have to worry about preventing it. But once you start to see, the telltale sign is the hairs are there, but the hairs are smaller, and you can kind of see through there, and you can just tell the hairs themselves are thinner, and what we call hair shaft diameters. The process is literally called miniaturization. And when you start to see the hairs in a certain area get finer, maybe they don't grow as long, maybe you got long hair, but the hairs in the active area of hair loss are only growing to be like a ½ inch. That's then is the time to consult with an expert. You don't have to have surgery, but it would be a time to, start taking action, whether it be a topical medication. You don't have to take the pills anymore. There's laser caps, there's PRP. There's a couple of different highly effective things that I would recommend to patients. And, we can custom treat based on the patient's individual situations. But yeah, if you don't have hair loss, it's not something that you want to work to prevent. It may never come.
I will tell you that I just want to say that I thought it was genetic, and I was like, okay. So my father was cremated, and I dumped his ashes in a state park, and I love him dearly. But I did dig up my great-grandfather, my grandfather, and I kicked him in the ribs just because it made me feel better, because I felt like I'd gotten it from them. I'm like, this has been passed down to me. So,
you did this.
You did this to me, but you don't know why. You don't know why one guy has a full head of hair and never worries, and why another guy loses it.
That's what I was wondering. Is it your mom or your dad?
What do you want him to set it up?
Is that?
Wait, what's he getting? Can I see that? Oh my God!
We had delivered everything. Thank you very much, sir. Oh, the whole thing.
Gosh!
All right.
By the way, I want to let you know,
Very nice.
he's a doctor. He can tip you huge. I want you to know that.
Bottle of bubbly.
Bottle of
Thank you, senor. Okay.
Oh, that's awesome.
Not a bad hotel here.
Oh.
You mean they sent that to you? You didn't order it?
No, they sent that to me. Just I stay here a bit, so they
know you.
You want to tell us? You want to tell us what hotel you're in? What else?
All right, so I got chocolate covered strawberries. Thank you. Wow.
I will tell you, you're only supposed to eat those naked. Those are naked desserts.
Yeah, we'll put those right there.
Don't eat those now. Don't eat them now. Not in front of us.
Well,
although Evan would probably watch. It's one of his bad habits.
It's a bad habit. I'm working on it.
That's it. Brett and I would be gentlemen. No, that's fantastic. What hotel? Where are we staying? You're in Santa Monica, though. I know you're going to go rollerblading in a little bit in Venice Beach.
Well, I play roller hockey. Yeah, I'm at the Casa del Mar Hotel. It's right on the beach.
I know where you are. I know where you are.
Yeah,
I love Santa Monica.
And yeah, I do. I am from Canada. I do play that. This is one of my roller hockey blades. I call them, or skates.
Mm-hmm.
But yeah, I brought a stick and some skates, and right down there in the parking lots below the Santa Monica Bluffs, a pickup game. And it's, a bunch of guys from upstate New York, Minnesota, Canada, Finland,
Wow.
Sweden, sometimes Russia. It's a bunch of a bunch of talented hockey players, and we have a good time. It's just a pickup game, but it's one of my favorite things to do in California. So always come prepared.
Again, we're talking with Dr. Ken Anderson, and I just want to say, with 2 locations, in the Atlanta metro, Sandy Springs, or, up here at Avalon and Milton, where I went, it's the Anderson Center for Hair. That's the website. It's atlantashairsurgeon.com. There's several ways to find Dr. Ken Anderson. And I just want to say the Atlanta Magazine, which is, my father was the art director back in the 60s into the early 70s, which is why I live downtown. Just the fact that magazines of that quality acknowledge you, and for 8, 9, 10 years, you've been the #1 guy. It speaks highly, and people that are in the industry are extremely knowledgeable of you and your work. And, some of them try to undercut saying, hey, but you're going to get it done cheaper here. It's not the same quality. It's not the same thing. And like you said, it is affordable, and it's not always, surgery's not always the route. If you want somebody to give you an honest opinion and no pressure, 0 pressure, get an appointment with Dr. Ken Anderson. Come in, they meet with you. I watched Axel do it. I did it, my father-in-law, and I know the drill. And I got to tell you, it's so relaxing, and the conversation, and you look at the hairline, and I bet you give a different answer all day long to different people, because you don't look at people the same. It's not like we're doing this. Everybody's different.
That's exactly right. Everyone's different. Everyone has different desires, different levels of hair loss, and you got to factor in their age and other factors. One of the things of which I'm most proud about the practice is that I think, because it turns out, as a physician, all you need is a medical license. No surgery training of any sort is required to offer hair restoration surgery. A psychiatrist in America could today put down the pen, buy some surgery instruments, and tomorrow perform hair restoration surgery. Literally, all he needs is medical malpractice insurance and some instruments. So as a facial plastic surgeon who's dedicated his entire career over the last 20 years simply to hair restoration surgery, that's caught the attention of a lot of people in the medical community. And one of the things that I was going to say that I'm most proud is that over 5% of my patients are themselves practicing physicians, surgeons, and dentists.
See, that's unreal. People that are surgeons and people that actually you train. That's a lot of people don't realize you train surgeons to do what you do, these
I founded the American Academy of Hair Restoration Surgery, and we've trained over 62 physicians from around the world in various and advanced techniques of hair restoration surgery. But getting back to that earlier point, at least once a week, it seems, sometimes twice a week, we'll have and last week it was 3 times. We had 3 different doctors from 3 different specialties, and they come from all over. We've treated patients from the doctors yesterday were from, or last week rather, were from Charlotte and San Francisco, all over the United States, and 36, I think 38 different countries have come to Alpharetta, Georgia.
Wow.
To see me. And, I kind of had that thought, just as a career insight, when 2003, I discovered the field of hair restoration surgery, and I thought, man, because I really enjoyed it. Creating a hairline is very much like creating a work of art, and I'm a published, trained medical illustration artist, and so that really translated well to hair. But when I discovered hair transplant surgery, I thought, geez, it had just gone at that time period from the plugs to the single-haired follicle transplant technique. I thought, man, if as a facial plastic surgeon, if you just do hair transplant surgery and just concentrate on that one thing, you'll be sought out after as your career progresses, and that has turned out to be definitely true. So that's
best hair restoration
practice.
You got best restoration practice in Atlanta by Best Self magazine 8 years in a row.
Yeah.
I mean, it's easy. Maybe it's easy to be a rock star in Atlanta, but when you look at top 25 in the world, that's pretty kick ass. And that's why I wanted to have you on the Come On podcast. One thing I want you to address, and then I wanted another question from you, Evan and Brett, is there are people that are using the robots, and
Yes.
there are people that, with me, it's a bilateral, not bilateral, but an incision to
Yeah.
remove hair. There's two ways to do it.
Yep.
Can you talk about that, because you do both?
Yeah.
Can
Of course.
can you explain what I honestly don't know what Steve means by the robots? Like, what does
Okay.
that mean?
Okay, let's talk about it. Patients come to see me for hair loss, and so in the recipient areas where the grafts are placed. And so if you have loss along the frontal hairline, that's called so what happens in the recipient area with the grafts going in and then growing there, that's the same no matter which method we use. The two different primary methods of performing hair restoration surgery all have to do with what happens in the donor area. The area, the permanent zone, that kind of the horseshoe area that even older gentlemen have as they age. That hair is permanent. That hair does not is basically immune to the hormones and causes of hair loss. And so you could take that hair off the back of the head. You could put it on the inside of your arm. You could put it on the tip of your nose. You could put it where you need it. It will continue to grow where you put it. It doesn't know it's been moved from the permanent zone. And that's kind of why hair transplant surgery works. The hairs are permanent, and it's a transplantation from the area of permanency to the area of need. The skin here is fine. It's not killing out the hairs. The hairs themselves are in the recipient area, the areas of hair loss. Those hairs are not dying off because the skin is beating them up. They're just genetically programmed to get smaller. And so we can replace them with hairs from the back. Now, that being said, how do we get the hairs from the back? There's two ways to do it. The gold standard way is the linear method, the FUT, or follicular unit transplant method. That's the method Steve had. That's where a little tiny strip, a horizontal strip, 1/2 inch or less in thickness of scalp, is removed. And then all those little hairs are dissected out from within that little strip under dissection microscopes. I've got a ton of them at the office. And then I do a facial plastic surgery closure on that horizontal little tiny wound. And I do it in a way that causes the hairs to grow through the scar. You do end up with a thin, fine line scar in the donor area, but the hairs that goes across the grain of all the hairs that are growing there. So to find it, you'd have to kind of comb up through that area, looking for something and go looking for it. Some guys, so that's the first way. Some guys want the option of wearing military grade short haircuts, very short haircuts. And so one option there is to remove, instead of a horizontal strip, you can trim down a little bit of the donor area and then use either a handheld punch or a surgical robot to extract one single follicle at a time from that horseshoe shaped permanent area on the back and sides of the head. So the surgical robot is something you kind of, it's kind of like a chair, like a motorcycle, and you kind of put your head into a halo, like kind of almost like a massage chairs you see at the mall that are kind of half upright. Then I'll sit at a computer desk and work this robotic arm. It's got like 6 joints in it, and the business end is a head with 2 stereoscopic cameras and a little robotic punch. And I'll kind of work that from the computer terminal to essentially extract one follicle at a time. Either that or we have a handheld device. This is a technique I've been offering for about 20 years. I was one of the first guys published in the medical literature worldwide on one of these cases back in 2004. In any case, the major advantage there is that instead of creating a fine line linear scar, with each follicle, it's just a tiny little pinpoint scar. And so if you need 1,000 follicles, you'll have 1,000 tiny pinpoint scars across the donor area, and they're very difficult, if not impossible, to find. And as a result, you can wear shorter haircuts, which is the primary advantage there. Steve didn't opt for that because he loves his long hair. And so
never doing a military cut, man.
Right. So
they won't even take me. I called them. They say I'm too old. So screw it.
That's cute. So yeah, that's what the robot means, and that's what the FUE. Those are the two major ways of accomplishing a hair restoration surgery.
Anything, Evan?
Yeah. So something I was curious about, I guess, is like, what makes a patient stand out to you? Do you have like I don't want to say like a crazy story, but something that you're like, oh wow, we got into this and it was not the way I expected?
There was one patient that that it highlighted what hair restoration, remember I said earlier about how impactful hair restoration surgery can be?
Yeah.
I'm going to compare that with a story that from my fellowship in facial plastic surgery. I did an upper eyelid surgery, a blepharoplasty it's called, and where you resect some baggy eyelids. I did it in the clinic. The patient was awake. It was under local anesthesia. It was very stressful.
Yeah. Oh my God.
Yeah, a tiny little bit of tissue, and and sewing it up. It was stressful. The patient came back. I was so proud of myself because they looked great. And but the patient, she was like, that's great. Patients or people at work don't think I look as tired anymore or as much anymore. I got to go back to work. Great see. And I was a little underwhelmed at her response. And I was like, all right.
You're like,
So
I killed that.
Well, I was kind of like, yeah, I thought I was more excited than she was. So I got to tell you, this guy, his name's Frank. He comes in, this is about 2 years later, about 2004 or so. He comes in to see me. He's 77 years old. He's about 5 feet high, and he's got hair as white as my white coat, just sheet white hair. And he's got hair loss in the front. And we're talking, he's very stoic, and he's like, I want a hair transplant. We talk about the nuts and bolts, and then out of his very well dressed, this was here in Beverly Hills, California, he pulls out a picture of young Elvis and he pushes it across the table. I start chuckling. He says, no, I'm quite serious about this. I'm like, you gotta be joking, but so in my mind, but of course I'm like, yeah, we'll get it done. And I basically just transplanted a bunch of hair for him. He can't, and here's the point. He comes back the next year. He's 78 years old, and he comes back. He's got a stylish blazer on, and he's got this white pompadour, and I'm looking at it, and it was all like young Elvis, like that. Yeah. And he told me, unlike the woman I'd done that, he said to me, he said, Dr. Anderson, this is the best thing that has ever happened to me in my life.
Wow.
And I said, would stop it. I said, you're 78, man. You got great grandchildren. It's a magnanimous, over-the-top comment. But he doubled down. He's like, no, I'm quite serious about this. This is the best thing that has ever happened to me. And I thank you and your staff very much. And I thought, well, you know what? This is something right here. It's so powerful. And over the years, there have been other comments like that. But Frank has stuck out, because that's the day I realized, I'm like, this is, because I just decided at that moment, I'm not going to go back and start doing because I was only about a year into my hair transplant surgery experience, and I was loving it, and sort of Frank sort of confirmed my suspicions that this was, what I wanted to do with my career. But yeah, that patient sticks out. I never forget him.
Well, you know what? And anybody listening right now that's thinking about it, here's the cool thing. If you've got a week vacation and you can take it off, only your spouse, girlfriend, or your roommate will know you did anything. If you've got a week, by that time, I'm telling you, I was back to work the next day. As far as any of the, like blood or scabbing or anything, within 5 days, you're already able to wash your hair with your fingers and lightly move around. And you can't tell you did anything. So if you've got a week, definitely 9-10 days, or you can wear a ball cap in what you do, no one will ever know you did anything. I can assure you, because there's a lot of people that want to be confidential about it.
Oh yeah. Is that weird? Is that weird to have a lot of your work be kind of like, like you'll know, but they don't.
It kind of sucks in a way, because a guy comes in with the most amazing result. I'm like, hey man, can I put that online? Absolutely not.
No.
Yeah. You cannot use my photograph. I'm like, well, geez, it's kind of
understandable, but damn.
But I will tell the viewers and listeners, my view about hair restoration is that the hair needs to look like it's always been there, and not like somebody put it back. So
yeah,
as a medical illustration artist and as a 20 years experience doing this, I think I have a real a knack for making it look natural. If it doesn't look natural, then what are we doing here?
Yeah.
So I have a personal question to ask you.
Sure.
So the thing that I'm curious about, we were talking about it earlier, is you said, I'm thinning. That's obvious. But I had an incident when I was 15. I was wrestling stupid and I split my head open.
Yeah.
And I had 52 stitches across my head. So I have a major scar across the top of my head where it was 26 to cover the scalp and then or the skull, and then 26 over top to pull the
So
scalp
you're going to
back
look
together.
like crap bald is what you're saying. You're going to
Basically
look
what
horrible bald.
yeah the
You're gonna
doctor
look like a baseball.
Yeah, the doctor at St. Joe's I said, is there anything I can do? And he said, don't ever shave your head. And now I'm getting older and it's thinning out. And I'm like, well, would that affect anything that I have this major scar across my head? Or can you guys work around things like that?
Well, we can put hair into scars.
I didn't
There
even,
you go.
they didn't tell me that back when that was 2000. What would that be, like 2006, 2005?
I would tell you, most doctors don't know a whole lot about hair. Even dermatologists. I find many patients like, well, I had hair loss, went to see my dermatologist. I'm like, what do you tell you? Use Rogaine. They more often than not, dermatologists are not really up on the latest treatments. That's why it's worth seeing a hair restoration specialist. But yeah, I would tell you that, yeah, preventing hair loss for you is going to be a little bit more important than the average bear because you've got some scars up there. But I will also tell you, we've got two ways of dealing with that. We can put hair into these scars. There's also something called scalp micropigmentation, or SMP, which is kind of like a cosmetic tattoo. That's the same. So it looks like stubble that we match it to your hair color, and it kind of just tones down the visibility of the scar.
I never even knew that. I never knew that. That's great.
I'll also say that I started looking at some of this hair restoration stuff a few months ago with my wife. And, you hear these major brands on either podcasts or radio stations or TV. And we did sign, or, she went in and did a profile for me. And I was like, okay, this is really cool. And I went in and I looked at it, and they constantly send me emails, and it'll be like, one email is like hair restoration, what you can do, this product, you put in your hair, it does so much better. Then the next email is about like beard gel. And then it's like 15 emails in a row about erectile dysfunction. And I'm going, well, why am I going to this? Because I have this issue, and now you send me all these other issues. And I'm going, I don't have these issues. Why can't we focus on the one?
Well, you are experiencing the difference between corporate medicine and boutique medicine. And, corporate medicine are owned by corporations, and they're big, and their primary interest is in making money. I'm not going to name names about different major corporations, but
I know the names. They're in my emails.
That's the reality. But a practice like mine, for instance, my name's on the door. I care about my patients, and I care about how they feel about themselves and about their hair, and so it's something I enjoy talking about. So, with more of individual private practices, you're gonna find a different story. We find that patients hate that. I mean, we send out like one email blast a year, usually around Christmas, but just to say Merry Christmas. But yeah, it's annoying, and I think they figure if you're going to spend money on, cosmetic anything, that, maybe you need some Botox, maybe you need some, especially if you're a guy, maybe you want some erectile dysfunction pills, and it kind of,
see, that was the one that threw me off, because I was like, that's not the issue here. It's the hair. And I'm going, do I really want to trust this company?
Yeah, that's why you got to go to the best. And we're going to let you go because, first off, you have an attractive woman, very attractive, tell her. You have chocolate covered strawberries, and somebody just delivered you a bottle of champagne. And you're in Santa Monica, California. But I just want to tell everyone that you did this as a favor to me to come on. And I want to thank you. You can also listen to The Good Doctor on Rock 100.5. But I just want to, and we're going to put this up on the screen. It's AndersonHairCenter.com. It's the phone number is very catchy. It's 404-256-HAIR. And if you wonder what hair is, that's 4247. So 404-256-4247. AtlantaHairSurgeon.com. It's the Anderson Center for Hair. If you remember hair and Anderson, you'll find my buddy.
Yeah, not hard
to find him.
Yep.
And I just want
All right,
to
boys.
thank you. And I just want to say free consultation, zero pressure. And anybody that decides to do any procedure with you or do anything, if it is between 12:30 and 1:30, I will stop by personally. It's on my way to work. I'll give you a Yeah Come On Show t-shirt. I'll give you a bottle of Legends Yeah Come On bourbon whiskey, or I'll just hug you.
Or if
But,
you're coming to Avalon, Steve, you can leave those with me.
yeah, I realize Evan works in Avalon right down the
Sure do.
right down the road from you. But there's also a location in Sandy Springs. So trust me, Scouts Honor as an Eagle Scout Troop 909, 1983.
Oh, look
Jonesboro,
at
Georgia.
you. Look at you.
This guy is the best, and your time is precious, and I appreciate it so much. And we look forward to getting you back into Atlanta and doing what you do best, buddy.
Thanks, brother. Thanks, brother. Well, hey, Steve, call. I appreciate that offer. Call me anytime. And Brett and Evan, if you guys have any questions for me,
I
call
might
me
need the
anytime,
consultation. I'm not going to deny that because, like
Yeah,
I said,
when you come for the consult, you'll get a packet of information, and we can sit down and talk. Because a lot of patients, even my brother, he's like, "Hey, what do I need?" I'm like, "Bro, you need a consultation, so we can talk about all the
now, are you going to be the last person that ever cuts Southside's hair short? I guess that's a question for the both of you guys.
Yeah.
You don't have to cut the hair short.
Now,
Isn't that the whole point of it?
Didn't you cut out some of the back, or how?
Oh yeah. From the tiny little area that I took it from in the back. Yeah, the hair was.
Oh,
cut
Steve doesn't let
it's
anyone
fine,
touch
dude.
that hair.
You can't even tell I did
No,
anything.
you can't, look how much hair he's got.
Yeah, it's crazy. Does it make it easier when he's got a ton of hair?
No, actually,
Oh.
makes just hard to get it out of the way. But
Yeah, that's right. Yeah, yeah.
It's not. We've been doing it. I've got a very experienced crew to help me, and we've been doing hair training. My crew. It's weird. We have a combined experience of over 170 years. I'm not joking. With the whole 2 surgery teams and combined, it's I don't have any I don't train technicians. I train doctors to go back to their own practices. But for my practice, for my patients, I've got some of the most experienced people in the field, and so they can deal with anything, long hair, short hair, it doesn't really matter.
And they dealt with it just fine, and they're awesome. And I loved going back in and and seeing them again and getting the sutures out again. I was back to work the next day.
Yeah.
It is painless.
Hey, Dr. Anderson, I got one more question.
Let him
for
go,
you.
man.
I'm sorry.
Let's hear it.
I'm sorry.
Bring it.
Steve,
Damn it.
Steve will totally understand this. I went out to a bar one time with one of my buddies, and this guy is a finance guy. He is very about the numbers. He is, not very social. So he loves having a radio guy, which, I'm behind the scenes, little on air stuff, but I'm not Southside Steve. I'm not walking in the room demanding all the attention. And he saw these girls sitting at a bar, and he goes, "Hey man, do you think we could pick them up?" And I said, "Yeah, let's do it." Now, he was one of the guys that was losing hair at 15. He's, my age, and it's bald up here. He's got the Costanza, I believe, as they call it.
Yeah.
And he always wears a hat. And I said, "Watch this. I'll go get these girls to our table right now." I walked over and I said, "Excuse me, ladies, can you guys decide something for us? Come over to the table. Which one of us has the worst hairline?" And I made him take his hat off and show it. Now, am I a jerk for doing that?
Yeah. Sorry, I know that was not a question for me, but yeah.
Yeah, that's pretty harsh.
It got the girls to the table.
Nice, dude. Nice.
Yeah, and they left.
No, they hung around.
Did you leave together though? That's a lot. Inquiring minds want to know.
Yeah, no doubt.
I'm married now. No
Yeah,
answer.
that's you're a hot mess. Again, thank you for your time, Dr. Ken Anderson, the Anderson Center for Hair, located
pleasure,
right
guys.
here in Atlanta. Thank you,
My
brother.
pleasure, guys. Call me anytime.
Thanks,
I'll talk
man.
to y'all soon.
Oh yeah,
All right,
for
man.
sure.
Bye.
See you,
You're
doctor.
All right, real quick, our lovely podcast. This is podcast 148, brought to you by joebees.com. Bee pollen. Does it help grow hair? No. But does it keep you healthy? Yes. Does it give you energy? Yes. Should you take it first thing in the morning? Absolutely. Oxygenfinancial.com. That's for all your finance. Make sure you're doing the right thing with your money. And if you're scared of what to do and watching your 401k, and I'll use Ted Jenkins' words, turn into a 301k, then you need to contact Oxygen Financial, which is also where Evan Brando works.
Hey.
And Yeah, look at you. And circle285.com. A lot of people jumping on this. Get a quote. Got to get a quote on your home and your car insurance. You should probably bounce around about every 2 to 3 years. They give you free bids. They let you know what you can get your insurance for. There's no cost, and they can put you in touch with type A companies. Legends, yeah, come on, bourbon whiskey. Man, I'm about done with this bottle, but it's been good to me. That is right there in Cumming, Georgia. Legends, yeah, come on, bourbon whiskey. Get it wherever you get your spirits. And lastly, Dr. David Markwell of Ridgeline Counseling. No, Brett, I'm not going to ask you. Dr. Markwell counseled me prior to getting married. He can talk to you about anything in person or Zoom you. Go to markwelltherapy.com. David is your man. He's probably the one guy that's been with me the longest, and I've known him since 2013. And he's straight up, and he's helped a lot of people. There's a lot of people hurting out there, and mental illness, as we know with Kanye, is a serious thing. So if you got to talk to, good God, talk about the meltdown of all meltdowns. So if you got to talk to somebody, never be ashamed. Nobody has to know that one either. And give David Markwell a call. Once again, it is show 148, and Evan, it's you and I, and Brett has left the room.
Oh dear.
So
well,
I think he's going to look at his bald spot.
That was cool. So when you
did you like that talking to him? I mean, that guy
Yeah.
is actually, he is the best. And that's the thing. When you endorse somebody, especially in radio or something, the last thing you want is a listener, somebody that's the most precious thing in the world. Anybody gives us the time of day.
Oh my God.
Coming to me and being upset. That's why you're not going to be upset if you go to D. Geller & Son. You're not going to be upset if you go to QC Kinetics. I only endorse the best because that's what I want for people. And you can read through a lot of these. You guys know the industry. And when he came to me, I was like, I tracked him down. It took 5 years for me to endorse Dr. Ken. And I'm like, dude, you're the rock star. Trust me. He goes, I don't know about radio advertising. I'm like, you got to let me let our listeners know about you.
Something that is shockingly consistent in a lot of the radio personalities, maybe not shockingly, but a lot of the radio personalities I work with and including myself, are very, very tight to the chest with sponsorships. Like they're not like, yeah, man, I'll do whatever. Yeah.
You don't want to take a money grab, and there's people that I won't work for that do a fine job. I'm not going to endorse Pepsi. I'm born in Atlanta. I drink Coca-Cola.
It's not believable. Yeah.
I'm not going to do it. I'm sorry. I don't care how much money you throw at me. Mountain Dew, I did that once, and that's a Pepsi product, but I loved effing Mountain Dew. I drank the
Mountain
crap
Dew
out
is
of
delicious.
Yeah, that's a good old boy drink.
Code Red got me through finals in college.
I'm going to go ahead and tell them that Pepsi, the greatest thing you ever did was Mountain Dew. But I'm a Coke guy. That's what, bourbon and Cokes. That's what I drink. Now it's, come on and Coke.
Yeah.
So but I appreciate you, you saying that.
I think anyone who's super knowledgeable, for me and the listener who is listening, I don't know if you agree, but just anyone who's an expert in their field or has cool stories or anything like that. I mean, I just like that stuff,
Yeah, and this guy, when you look at what he's done, top 25 in the world.
That is crazy. I didn't know that when we first booked it. I feel like we're in the green room talking about him like he's not,
No, dude, that's kind of what I thought we should do is be post interview, he's insanely knowledgeable in his field,
And we would never say that to his face.
No, and it's not a money grab. It's not. They're not going to push you into surgery. They're going to look, and like he said, and Brett, for somebody like you, this ointment, you can get it, sent to CVS, Walgreens, wherever you get your prescriptions, Kroger, whatever. And he's put it together. And dude, you rub this in your hair, and every morning you just wash it out, or you can leave it in. And that, along with a laser cap, which he sits under a laser cap, Dr. Ken does 20 minutes a day. And he's convinced
I like how Evan
works.
tried to get in on this when this guy has the biggest quaff ever. And I'm like,
I may not someday.
Steve, there's 148 episodes. When we started, it was at my eyebrows, right?
Brett,
was it not? You've gradually watched this get worse and worse and worse. I'm telling you, dude, if I salute like this.
Oh, that's high. That's high salute.
Yeah, look at that.
Are you supposed to do it at hairline?
I don't know. My hairline's longer than Brett's, but God bless you, Brett. And it's
Yeah,
not, it's okay.
you
Brett,
be
we
slipped
can
at your
fix it.
nipples.
We can fix it, Brett. But yeah, I mean, that's the thing. So, people look at it and they're like, well, how much, man? Don't let the price tag scare you. So what if it's 7, 8, 9, 10 grand? Dude, finance it, do what you got to do, but get your hair back. Cause with him, it's almost like a one-stop shop, man. He does what you need, gets it done. And then the rest of your life, it's just a little bit of prevention and you roll on.
Yeah. But at the same time, we don't know if it's 7, 8, 9, 10 grand. It could be $200, $300. You don't know. He might have the right solution.
Oh yeah.
Is affordable to you. Now it
100%.
could be, it's like getting braces. It's like, yeah, you might need, you always remember seeing the people that had like the whole mouth and like me and like the crank stuff up top to separate everything. But then I also remember people that were like, yeah, I had to get braces. And it was only on like the front 4 teeth to pull them out.
It's a great example.
It's obvious that it has to be specific to what you need. And it's at least a baseline because like I said, my biggest issue is I'm on these sites, I'm getting their emails because my wife set some of this stuff up because she agrees with me after my coworker told me my stuff is thinning. That dude, brutal.
That is brutal.
Yeah. And from a 61-year-old man. 61.
Yeah. I'll give you crap. I'll give anybody crap about something that you can fix.
He's my boy. I talk shit with him all day, though.
No, and I'm not hammering him, dude. There's people. I mean, it's ball busting. That's what it is. As long as it's done good natured, he likes you. He likes you. It's all good. Believe me, I've made a living, and my personality is that to call people out. But if you got a gut or something, I'm gonna rip you about that because that's on you. But if you're experiencing hair loss or you have 6 toes on your left foot, there's nothing you can do about that.
Yeah.
I will push you to get that toe removed because it's gross to me. but you know what I'm saying? There's just certain things in hair losses, like you said, we don't know why.
If I break down my email, I looked it up as the show was going on because I have my computer right here for finish me off. I have 1,800 emails that are erectile dysfunction. And I'm going, that's not the problem.
Why don't you address that?
We went into like hair, and now you think I can't get an erection.
I don't think you can. No, I've never seen it.
I've never seen it.
Well, if I was going to pull anybody's hair, it would definitely be Evan's.
Thank you, Brett. I work very hard on my hair, and you.
Well, yours is fragile. It's 3 weeks out. I mean, give me another week or two. I might change my decision.
Well, don't grab me by the short hairs. Get me by the thick hair.
Baby, I come in with the claw.
It's all good. The claw. I just said, throw it up top a little and in the front. I just was like, let's just do it. I just wanted to show people, we're taking pictures so you can see how the hair grows and how the change. Obviously, I'm one of those people that doesn't care.
Let me ask, Steve, was there ever a point in your life? Because I know this was not your first foray into like hair reconstruction, but I mean, obviously this seems like the best one. But was there ever a point where you're like, maybe I'll just age gracefully and
never
just lose it? No, never. You're always like, this is gonna stay.
It was never.
If it's gotta be stapled in, it's gonna stay.
Not even being married, and having 2 kids, and I'm the most blessed guy. Anybody that's married and got kids, and you're about as happy as you get.
Yeah.
You just want everybody to stay healthy, and if something bad happens, let it happen to me. But no, I want to die with a full head of hair, and hair is just the one thing that I wanted to have. And, it's just, everybody's different, some people don't give a damn, and more power to you.
Dude,
but if it matters, do something about it.
And that's what's weird, because I kind of wanted to ask to be like, is it your mom's side or your dad's side? And I think we asked that for a second, and then they came in with a bottle of champagne and it kind of threw it off. But because like
I've always heard mom's side.
Yeah,
I hope not.
My grandfather on my mom's side, like he had a full head of hair, and my grandfather on my dad's side, he had a full head of hair. And I'm sitting here going, what the hell? But my dad still had like around the sides, the comb over, the bald spot, all that stuff. And it may be due to stress. Who knows? I don't know. I mean, my grandfather on my mom's side, he was a chiropractor, and my grandfather on my dad's side, he worked for the Catholic Church and ran real estate and was a Marine. And the other one was they're World War II guys,
Yeah, it's
So
hard
I don't know.
say. I don't either, and I don't think anybody knows. It's just like you said, there's so many different ways to handle it. The free consultation's a blessing. At least when you leave the Anderson Center for Hair, you're like, now I know. Now I know what I should do because this guy's going to shoot you straight. So you'll know what your plan is, and it's just a matter of when you want to do something about it.
Mm.
I was
So
curious. The last one I was going to ask him was like, he's out in LA. So you look at LeBron James.
Mhm.
Oh,
and,
he's
you know,
got it's all
he's
the way
gone
here. He's got
here
he's
to
slopes up
here
here.
to here to here
Yeah.
over years. He starts here at the beginning of the season. He ends here. He's back here. He's here the next year. Keeps changing. I'm going, what? Like, do you look at that and go, that's perfect because it moves so much.
Yeah, I don't know. I mean, and you know what? Between us, he could be out there doing some procedures for all I know, but I think he's out there recreationally and having fun because he worked in Beverly Hills for 10 years, so he's got a lot of contacts out there and he just loves the West Coast. But,
Sure.
he came here, Atlanta's home. So I would think if it was a surgery, they'd be coming to Atlanta, flying to him. But you never know. I don't know what he's out there for. I don't ask those questions, but I wanted him on. He goes, you know what? I'm in LA, but I'll do it. And I'm like, far out. But I wanted him on the podcast. So
Yeah.
I'm glad that you guys did it. Brett, I'll be honest with you. Truthfully, I didn't know you were dealing with anything. So
No,
now I'll
yeah.
make
I mean, like I'm honest on the show. Like, I've never told anybody that I have a scar across my entire head. I keep that to myself.
well,
Mm.
that grosses
Usually-
me out. I just want to let you
Yeah,
know. I'm
don't
grossed
tell
out.
Steve that. He doesn't like
Yeah.
that.
I'm not. I'm
Dude.
too shallow for that. Now I look at you differently. I don't even know if we're going to be friends after this podcast. But I am going to. I'm going to help you with your situation, dude. Now that I know.
Dude, I was Humpty Dumpty, man. I split my head open. I remember I called my parents, and I'll even
My
give the
head's
whole.
cracked.
I'll give the whole story. My brother, him and his
Well,
buddy.
we don't care.
No, it's good. This is something like boys will be boys,
Go ahead, give me your boys be boys, and then I want you to finish me off because we ran long because we had so many questions for Dr.
I had more questions. Can you believe that?
I know.
Oh,
I know.
I still have more that I was writing during the show.
Hold on.
Yeah.
Woman in a short skirt in his room, chocolate covered strawberries and
Oh,
champagne.
there
I'm
is
like,
that.
I can't keep talking to him. I gotta let him go do what he does. But tell me, Brett, tell me how you cracked your head.
Yeah,
I
wrestled, started lifting, all that stuff. Wrestled one of my brother's buddies, this is like the uber gayest story ever.
Were y'all naked? Was it naked wrestling? I know
No, but he was like a senior in high school. I was a freshman, and I knew, lift the leg, sweep the leg. I watched a little Cobra Kai, pre-Cobra Kai. I actually watched, Karate Kid, swept the leg, took him down. He was like 6'4", 260. I was 5'5", probably 180 at the time because I was playing offensive line. And then my brother was like, okay, go for me. And so my brother put me in a headlock, and I went to lift his legs, and I took him. And when we did it, he took me backwards in through a cabinet handle that went into my head.
Ooh.
And it's like it was a vertical cabinet handle.
Oh, damn.
Through my head.
Ooh.
Metal, wood,
That's
everything. And my brother, and it scratched my brother's back, and he stood up and he was like, mother, and he's going off. And so I was like, well, I should run over here and pretend like it hurt my head. So I walked over and I was like, oh, my head. And then they turn and look at me, and I'm sitting over there on a chair, and I have blood just running down my face. And they're going, uh-oh. And I remember I was like, what? Because I was pretending I didn't have any pain at all. And they're like, we need to get you a towel. And they grabbed me a towel, and we put it on. It's soaking red. We called my parents at work. We're like, hey, Brett needs to go to the ER. He just split his head open. And they're like, how'd that happen? Well, he was, trying to get a pot out, and then he stood up and caught a cabinet. And and I'm
had to lie. You gotta lie.
had to go meet my parents, and they're like, what are you going to do? Because my brother had broken his arm previously and been going through surgeries. So I had to sit through all that where, like, you know, you get there, he broke it playing football, and it was like, you know, hours on end. And then I'm just going to walk in and yell, it's a gunshot.
Jesus.
Dude,
I
you
did.
know what?
I was in and out in like 2 hours.
Well, you know what? That's a smart thing to tell them. I think I've been shot. Then they'll take you in immediately, especially at Grady. But you know, all it's telling me between the broken arms and the hurt that the Barneys are brittle Barneys.
Brittle Barneys.
That's what it sounds
Which is
I've
odd, 'cause
never-
Brett seems like he'd have a
I've
you know,
never
high
broken a
constitution.
bone in my life.
Oh,
Torn
can't say the same.
ligaments. I've
I almost
done everything.
broke my
Never broken a bone.
penis. I had a girl go back on my penis, and I was like, thought I almost
Dennis
broke. Don't take
Rodman
that.
style.
Yeah. Yeah, it was reverse cowgirl with a twist. I'm like, hold it. But I need you. Let me see. This is from my wife. Let's see. Like, what's taking? Are you coming?
Yeah,
getting
Brett,
the
let's finish
monitor?
this. Finish it
All right,
off.
let's finish it off. Let's finish it off. Y'all ready?
Let's go.
I'm gonna fire you guys off some stuff. Just so you know, Evan, Southside did hit one on the head last week. Nailed it
He's
verbatim.
been like consistently won.
Yeah,
I know,
he's
dude. And
the
it's
only
crazy.
one
I
who's
had
done
no
it,
idea.
and he's done it twice.
Let's do it.
You ready? Marijuana company sued for not making customers
High enough?
Ooh, I think you took it. Marijuana customers.
He did take it, by the way. That's verbatim. High enough.
I'm about
I'll
to
give
say,
you both
what's
that.
up?
Yeah.
Boom,
Yeah,
baby.
because I'll be honest with you, there was nothing else to be said. I'm like,
Yeah.
Evan got it.
No,
Evan
yeah,
got
it
it.
felt like
Yeah. I'll give Steve 3, give Evan 1 on the scale of perfection. Let's
Right.
keep going. By the way, I have 6 tonight.
all right.
Priests and nuns watch
Porn.
Priests and nuns watch dog fights.
Southside 4 in a row. Porn, says Pope.
Woo!
Woman escapes bear attack by
Seducing the bear.
Throwing her tampon at him.
punching it in the face. I guess treating it like a shark. I don't know.
That's what you're supposed
I
to
don't-
do. That's why I think I
don't
can
know
take a
that-
bear.
I don't think that would work, but I think the scent of blood that would occupy his time so you could run away. I think throwing the tampon would work. I think women should do that in that situation. I'm just saying. Go ahead.
All right. Trial over death at Colorado strip club delayed after key lawyer.
Enjoy his time at strip club. He like goes to check it out and he's like, you know what?
Goes snow skiing.
Dies there too.
Oh my God.
The key lawyer went to
God.
investigate, died there as well.
Oh, damn. No, I didn't see that coming.
Minnesota man accidentally shoots himself.
In the penis. It's
Uh,
always the penis.
That's it. That's the end of the title.
Getting corn out of boot at corn maze.
There's no way.
Yeah, I don't know.
No, there is a way. It's an actual headline. So, last one. 13 people come forward after Texas janitor is accused of.
After Texas janitor is accused of selling kids lunch. Like he's got like a smoker out and he's selling kids his own smoked meats.
Distributing drugs, which is weak, but that's what it hit me.
Urinating in their water bottles.
Damn.
Oh, damn.
That's nasty.
That's gross.
And that
That's
is
gross.
to finish me off.
Well, you know
Nice.
what? We each got one. I got 4 weeks straight. I'm loving life. You know what? Y'all gotta get it. One.
Evan's
me
on
tell
that
you-
one streak.
Got one, baby.
I appreciate it very much, boys. We're going to take care of you, Brett. Evan, we're going to adore you and your full head of hair. Although you catch a lot of hell, people say you touch your hair too much.
I know
you-
they do. They're right. They're not wrong, but
Okay, so just try to leave your hair alone.
Yeah.
And, Brett, we're going to give you more to play with, and I've already done it. But it is show 148 of the Yeah Come On Show podcast. We appreciate you as always listening. Hopefully you do business with our sponsors. We all think they're great people. And can I get a yeah, come on?
Yeah, come on.
Come on.
All right. You know what, Evan? I appreciate you being normal. Brett, I don't know what the
Thank
hell that was. I think I'm turned on though. Hello.